Erica Shepard, and I'm the Vice President of Patient Success here at MyEyes. And I just want to thank everyone for joining the webinar. Just a couple of notes about the webinar tonight. We'll have a 20-minute presentation from Dr. Anthony May from the Moran Eye Center, and then time for questions and answers. To ask a question, just put it in the chat, and at the end of the presentation, we'll go through everybody's questions, and Dr. Warosco and Dr. May will answer them. The audience will be muted with cameras off, so if you need to go check your IOP during the webinar, go ahead, you can do it. We can't see you. So I'd like to introduce Dr. Barbara Warosco, also from the Moran Eye Center, esteemed glaucoma specialist and co-founder of MyEyes. Dr. Warosco.
Thank you, Erica. And it's my great pleasure, actually, to introduce Tony. So Tony is a resident of ours and a future glaucoma specialist, and he's been very interested in this topic. So with little ado, I'm going to turn it over to Tony.
Hey everyone, thanks for inviting me, Dr. Roscoe, Erica. Like everyone said, I'm Tony Mai, and I'm currently a last year resident at the Moran Eye Center right now. So just a quick brief about me. Grew up in Southern California, went to medical school in Iowa, and I'm here for residency. So I'll be finishing up this upcoming summer, and then I'll be going to Vance Thompson Vision to do a glaucoma and combined cornea fellowship too. So I've been very excited to do this talk for everyone. It's something that I'm very passionate about. So there's some information that I'm very, very excited to share with you all. So let me share my screen here. All right, so let's jump into this. So first off, I don't have any financial disclosures here. And I just want to start out here with a nice, beautiful picture of my grandparents. My grandfather there on the right, he has terrible glaucoma himself to the point where he only has just a little bit of central vision on both sides. He's gone through a lot of glaucoma procedures. So this is something that I'm familiar with, and I see him struggle living with it too. And so it is close to home. And this is from his own words. I used to be really independent, but now it's really hard to do just normal things like drive, read, walk outside. He used to be a very independent person, just living, taking care of himself and my grandmother, but now it's increasingly difficult. So he really relies on our family to come and help out a lot more. And because independence was so important for him, it's been really tough dealing with glaucoma during this time. So just me watching that has been something that's really galvanizing me to do something for other people in this sense. So a lot of times when you go to the doctor with glaucoma, we ask, how's your vision? Have you been taking your drops? But very rarely do we explore further and see how glaucoma is affecting your daily life, things that are important to you. And even more rarely do we ask about how does a thought of glaucoma make you feel? This is something that has been really overlooked in just ophthalmology in general, things outside of just the hardcore like vision, the numbers, and we forget that there is such a large proportion of time outside of the clinic that's really important to the patients. How does this vision really affect their life? And this becomes important, as you'll see why. So I have here a cycle that, or a kind of relationship cycle that I'm showing where we're starting off with the vision loss, say from glaucoma or something else. But in this sense, the vision loss causes stress because now you have this diagnosis, you have this feeling of impending vision loss. And then as well as the thought of surgery, treatment, and all that compounds create stress. And we are finding out now in a lot of research that the stress actually contributes to damage of the tissues themselves in the eye, which then only increases the vision loss. And then it repeats this whole cycle. And so it's this vicious cycle that can really spiral out of control, especially for a disease like glaucoma. We're seeing that the stress can cause stress hormones to increase, especially steroids in your body, as well as some other ones that we'll talk about. There can also be increase in inflammation in all the body. That translates to the eye too. And then there's also dysregulation of the vessels inside of the eye, and this can make it more easy for the optic nerve to become damaged. All of these things we already know that stress causes, just in general from research and other things, not eye related. But we are showing here that Now, stress causes these things, actually affects the eye, and that does affect the drainage system, makes things harder to flow. And so there can be higher pressure and also affects the optic nerve so that there's less blood flow there and that it is easier for the nerve to get damaged because there's just more inflammation. So right now, most of our glaucoma therapies are really at that targeted at that red wedge there where we already have damage and we're trying to lower the eye pressure. There's some new stuff coming out to protect the nerve, but really most of our therapy, surgery, lasers, drops are all trying to lower the eye pressure. And so that is what we call a downstream effect where the damage is already there. But then what can we do to target the upstream factor instead in this cycle that we're presenting? So if stress is the upstream element here, if we lower stress, is it possible to get away from this vicious cycle and reduce damage downstream? So I have a quote here I found when I was doing some research on this topic, and I'll read it out loud. I find it really interesting that despite a compelling body of rationale, stress is of little concern to clinical ophthalmology because ophthalmologists are neither trained nor paid with helping psychological problems. And I think this is really true. Like, of course, we care about this, but a lot of times it's not something that we think about. It's not on the forefront of our thoughts. It's a busy clinic. But I'm hoping that as more research comes out showing how important this is, that it becomes something that we ophthalmologists start to think more about. And so, really, I ask, why is that? Why aren't we thinking about it? Why aren't we telling patients about how stress is related to glaucoma? And one is many people just aren't familiar with the topic, and that's really because there's not a lot of research out there right now about it. So, just talking about research in general, there's a lot out there, but just as patients, like what can you trust? And this is really difficult because there are many different kinds of research, and I'll just throw up some of the common ones that we see, things like case control studies, systematic reviews, cohort studies, observational studies, randomized controlled trials, and meta-analyses. And this is an overwhelming amount of different types of research. Even for us, it can be hard to sift through these and figure out what can we trust, what's not good quality. And so I totally understand why it can be very hard. The one that we really look at is the randomized controlled trial. So this is considered the gold standard in just clinical research in general. But just a quick brief on this is that there's a pool of patients and we randomly assign them to the treatment group and the control group, which is the group not having the treatment. We give the treatment, the intervention, say like meditation in this case, and the other group, no meditation. And then we see what happens between the two. This kind of study is our gold standard because it really isolates a lot of variables and allows us to see very cleanly the effect that the intervention has more than say just an observational study. We're just looking back in time and seeing what happened to people. This is hard to set up. And so for many emerging treatments or supplementations, these things might not have randomized controlled trials yet. And so, even though there might be some good evidence out there just on how things might work, we might not be able to fully trust it yet. And this is important because I bring this up because there weren't really any randomized controlled trials for meditation glaucoma for a very long time. This is a search that I did on PubMed, which shows over time what the hits are for meditation and glaucoma. The first one we see is in 1987. So the thought that stress leads to glaucoma has already come up a long time ago. And this one is about psychophysiological stress and how that can elevate intraocular pressure. And they really suggest that there is a strong link between the two. But as you can see, nothing was really looked at or done for a long time. And then 2002, there was a large survey done at Wills Eye Hospital asking what people did for the glaucoma. Did anyone do anything outside of the traditional therapy, like drops or surgeries, was there any complementary and alternative medicine? They showed that about 5% of people did so, and only of those 5%, one person used meditation for glaucoma. So at the beginning of the 2000s, really not many people were using it. There just wasn't that much data. But where we're going to focus on for this talk now is in 2018. So this is where some of that data really started to come in. And earlier, I was talking about how the randomized controlled trial is our gold standard. There was a group in India that decided to do a series of randomized controlled trials to investigate how meditation could affect glaucoma. So there's one in 2018, 2020, and then 2021. And so they asked and then looked at how does meditation affect patients with just controlled glaucoma on maybe a couple of eye drops, patients with uncontrolled glaucoma who are having high pressure despite all of the drops that they're on. And then lastly, how does meditation affect the blood flow to the optic nerve? And when they designed these studies, they used mindfulness meditation. So there's many different kinds of meditation, but mindfulness is one of the most common ones nowadays, and one that is easy to start for beginners. This was guided by an instructor, and it was a long session. It was 45 to 60 minutes guided, where they came in person, and they did this daily for 21 days or 3 weeks. And the studies asked these following questions. How does meditation affect the eye pressure? How does it affect the people's quality of life? And then can we find or figure out if it does affect eye pressure, is there something in the body that we can see evidence for why that might be, such as biomarkers in the blood, or even how the tissues in the eye actually respond to the meditation? And so they did that randomized controlled trial where they had a group who had that meditation, an hour every day versus a group who did not. And they took their pressures, surveys, blood before the meditation started, and then they did so after. And now I'm going to jump into just some quick results of what they were able to find out. And I won't dive too deep into this, and I can always answer more questions via email after if you're interested in just the actual data. But just to give you an idea, this is a chart for the very first study in 2018 for just people with controlled glaucoma who had pressures under 21 on a couple of eye drops. And here on the like pink fuchsia color on the left side, those are people who did not have any meditation, versus the people in that tan color. They are the ones who, after 21 days or 3 weeks with meditation, they saw a significant drop of 6 points in their intraocular pressure. And that's 32%. That is as much as adding an eye drop, actually. And that was a really surprising study, as we all expected that there might have been some drop, but not enough to the point to equal an extra added eye drop. And so that was really surprising, really cool to see. And just only after 3 weeks too, which is sometimes what we would give a medication to work. So those again were for people with controlled glaucoma. But then the second study asked, what about people who have uncontrolled glaucoma? Pressures that is higher than 21, despite having maximum number of drops. Now, we have to know that in India, the drops that they have there are not necessarily all the drops that we have here. They're close, but there are some here that we have that are not as available, say like Repressa. But regardless, these patients are all the drops that they have right now, and they're heading towards surgery. So the study investigators are asking, if we implement meditation at this point, when there's nothing else to do before surgery, can we actually save some people before surgery from getting that, like a large surgery, or would it not work in these patients? And they showed, again, pretty surprising results. In the chart right here, you can see there's a column for meditation plus their current eye drops versus just continue on the eye drops only. So there is a significant decrease, again, 23% decrease in the pressure. And this was a big difference from just 6% for the intraocular pressure. But something different that they did in this study too is that they also looked at the IOP range. And this is something that they very similar to the eye care home that you use. They checked the intraocular pressure every couple of hours throughout the day. And then they looked at the lowest pressure with the highest pressure and then what that range was. And they showed that there was a really, really large increase in how much that fluctuated throughout the day, the peak and the trough. And that definitely came smaller after doing meditation, almost up to 60% of a decrease in that. And they also looked at quality of life here, showing that clearly there was an increase in the quality of life for people who were doing the meditation, even though they were heading towards surgery and that was on their mind. So just jumping quickly into the quality of life, they did some surveys that were based from the World Health Organization. So these are qualified and vetted questionnaires. And in the red here, this is all the patients who did meditation. And it was after that, the red showed that there was just such a high increase in their quality of life scores compared to before the meditation. And this is as compared to the people who did not have the meditation. So now they're looking at the blood too, before and after the meditation, seeing is there any changes in the blood? And can those changes explain why people are having some of these good results? And they were able to measure that there were true decreases in a steroid that the body produces called cortisol. Many of you are familiar with how steroids in general can increase the eye pressure. We have steroids, a steroid hormone in our body too, naturally. And meditation decreases this. This is because the steroid in our body is a stress response. And if we are just targeting the stress response through meditation, helping us be more centered, more calm, cortisol levels do go down. And that's a thought of how the IOP, the eye pressure, might also be decreased because cortisol is decreased. In general, there's also less body inflammation too. And for example, TNF alpha, which is a biomarker associated with inflammation, was decreased. For all of these, I'm just giving one example, but in the study, there were actually multiple biomarkers that were increased and decreased, but just too many to fit onto this one page. So there were significant increases instead on things that are known to perhaps protect the optic nerve, such as BDNF, and other things that will help with antioxidants, such as total antioxidant capacity. So overall, meditation is changing things in the blood that we can see, decreasing inflammation, decreasing the stress response, and increasing things that are more protective for nerves and antioxidants too. The other really, really cool thing that they did during these series of studies was that they said, okay, the blood seems to be affected, but how do we know that the eye is actually being affected? Because just because things are changing in the blood does not necessarily mean that the tissues in the eye are responding to the treatment. So we need to actually get into the eye, get a sample, and then run perhaps a gene expression profiling on this and see, are the tissues really responding to our intervention, meditation in the first place? And I thought this was like a really brilliant way of getting in there and finding out for real, are things changing in the eye? So there's specifics to this I won't go over, but in a way, they did go into the eye and sample and biopsy one of the places that are most affected in glaucoma, which is the trabecular meshwork. This diagram here shows how the water in the eye flows from underneath the iris around and into the trabecular meshwork. You can think of it like the drainage system of the eye. And this is where, for traditional glaucoma, this is where most of the resistance to the flow is. That's where the drainage is, but in glaucoma, the run-of-the-mill kind, it's just really tight. The water can get through. So a lot of our therapies are kind of aimed at this spot too. And so the study investigators thought that perhaps if we sampled this area where most of the disease is, we can find out if meditation is actually influencing this drainage system here. And so in a surgery, they did sample a piece of it and they ran it for gene expression to see, are the cells changing themselves during this process? And amazingly, they did find that there were true changes in the genes and that there were decreases in genes involved with, or decreased expression in genes involved with thickening of that drainage system, and as well as genes involved with inflammation too. However, there were significant increases in genes that help with flow of the water through that meshwork, as well as increases in genes that are helpful for anti-inflammation. I'm not going to get into the nitty-gritty of these small genes, but in general, it's just decreased inflammation, decreased thickening of that meshwork, and then better flow through that meshwork. And then lastly, they also looked at the optic nerve. So they looked at the back of the eye. We have some imaging studies that can show the blood flow through, and it's a scan like a circle through the vessels around the nerve. And they also asked for people who had meditation versus people who did not, were there changes to the blood flow? Because we all know that more blood to the nerve keeps it healthy, and that with glaucoma, we do suspect that there's some damage to the vessels around the nerve, and there's just not enough blood flowing there, so it's more easily damaged over time. If we get more blood there, can that be a protective factor? And so they showed that this is before, it's a heat map showing how much blood flow is going around the nerve. And this is after. So in the after, those are some significant areas there where there's more red, showing that there's more blood, there's more dense amount of vessels. And this is all compared to people who did not have meditation. The statistics show that there was a significant difference actually between the two groups. So we went over some data. So just quickly in summary, these studies, series of randomized controlled trials, were able to show that there was a significant amount of drop in eye pressure. There was improved quality of life. There was decreased inflammation, steroid in the blood, as well as increased biomarkers that help with anti-inflammation. And then actually, the eye itself responded to this by showing that the genes in the eye for certain areas changed for the better, for increasing flow through that drainage system, and also flow in the blood in the back of the eye to the optic nerve. Now, shifting gears real quick, because this data that I've shown about meditation are all very convincing, at least to me, looked really great. But there are other practices too that many of us have been curious about, like say yoga or exercise or other things that are associated with a decrease in the stress response. So for yoga, there's different aspects of yoga. It's not just the movement or what we call the asanas, the postures. There are actually yogic breathing exercises. And there actually have now been new studies as of last year showing that breathing exercises are really helpful for lowering eye pressure. But we have to be very careful about breathing exercises that involve with breath holding. Anything that increases the pressure in your chest translates to increasing the pressure in the eye, and that can actually increase the eye pressure. So breathing exercises are very helpful, but things that are involved with just like a regular breathing pattern that doesn't involve a lot of heavy breath holding. Now, the one that everyone's really interested about is what about postures, movement, the typical yoga that you hear about and think about. And yoga in general is associated with a decreased stress response, but there was a study done that showed that the intraocular pressure actually increased with inverted moves. So things like downward dog, where you are having a lot of your body or your head below a lot of your body, that can increase the eye pressure significantly so with like headstands. So that's something that we would be more hesitant about recommending and would err on the side of things that would involve just having your body upright, that are more relaxed, and really more about breathing and just meditation in general. Of course, exercise in general is, but again, things that really put your body upside down that can increase the eye pressure. So just jumping into how do people get started in meditation? This might be something that some of you already know or perhaps are unfamiliar with. And it's something that we can also get into on a different discussion. And I can also have offline discussions about it, but I'll just very quickly talk about it is that there are many different kinds of meditation. It's like a sport. There are many different ways of doing it from many different traditions, and it can be pretty overwhelming when you first get started. But the easiest I think to start with is mindfulness meditation. One, because it's already been pretty popularized here in the Western culture. We're pretty familiar with it just in our daily life. And it is one that matches really well with just our culture. It doesn't have a lot of doesn't necessarily have a lot of either religious or other cultural traditions tied with it. It's also known as Vipassana or insight meditation. If you're looking around doing your research, there are other names to it too, but it's all the same thing. It's all mindfulness meditation. And it's really the best thing to start with guidance from an instructor. And this can be done through a local meditation center. Even the health system, like our University of Utah, has meditation offered. I believe even the Moran Eye Center has meditation offered through like our low vision team. And there are a lot of popular applications nowadays on your phone, like Headspace. And this is something that people can use just at home to get started too, as well as YouTube videos or just pre-recorded podcasts. There are many, many ways to get started. But I would just recommend starting with some kind of instructor, whether that's virtual, in person, or a pre-recorded something that can really get you started. It's really difficult to just do it by yourself when there's not much guidance. The goal, I think, is really consistency. So it's not the length of time that you do it for. Even something small like 5 minutes per day is a great place to start out with. The studies that we looked at earlier, they were doing 45 minutes to 60 minutes a day. And I understand that that can be a lot for many people. There's just not that much time in the day to commit to something like that. If you can, that's great, but totally understandable how that can be hard. So even something less, say like 5, 10 minutes, even if you can get up to 20 minutes per day, that would be amazing. So that's something that I'm really curious about to see, is the effect still there when we decrease the amount of time spent in meditation? I suspect yes, but there's just no studies yet. So we're really still in the forefront of this. These are just some examples here of applications that are really popular. There's Headspace, Insight Timer, the Balance app, and they're all great. I've all tried them myself. They all have free versions, paid versions. Balance app right now, just putting a plug out there, they have a 1 year free version right now, and it's a pretty good app for personalizing your meditation. So I find it pretty helpful. Personally, for me, most of my meditation is done without applications because I was slightly trained in the Vipassana tradition. I've been doing that for many years, as well as some Zazen and Zen meditation. And so for me, mostly I do it without an application, but just for most people getting started, that's something that I think would be very helpful. Something, and just to end here, I think this is something that would be really interesting. I was chatting with Dr. Orozco about how it would be really cool to see with the eye care home how meditation affects patients' fluctuations in their eye pressure, if we can see a difference there. One of the studies showed that that range of the pressure going up and down was decreased, but they didn't really dive too much more into the daily fluctuations. So this is something that I think if any of you are interested in trying out for yourself, we'd be really curious to hear about how this changes your eye pressures. But reminder that, it's not going to change right away. For these patients in the studies, it did take a couple weeks to see the effect. So just something interesting to see if any of you would do it at home. We'd love to hear some anecdotal data on, or just responses on how this have been helpful or not. And that's really just the end of my presentation. I know there's a lot more, especially about meditation itself. Is something I'm really, really happy to talk about. It's something very important to me and something that I really hope to continue in the future, just doing it myself, teaching other people. So always happy to do another webinar more involved in that, or I can just talk offline. So here's my email. Feel free to email me anytime and love to chat more about this topic.
Thank you so much, Dr. May. Just amazing information when you look at the decrease in IOP. I wasn't expecting that personally, but we will open it up to questions. So if anybody has a question, you can put it in the chat. We have a couple in there now. You kind of touched on this, but how much time of meditation each day do you recommend?
So yes, this is one of the first questions that all of us has when we're starting. And the answers vary so much. The best answer so far is whatever that you can do daily. So whether that is 1 minute, a single breath, 5 minutes, 10 minutes, that's great. But out of all of my research into the many different meditation traditions, the standard that is there is usually about 20 minutes a day. Um, 20 minutes up to 40 minutes is kind of the standard for just people who are working, have daily lives, who are like, not in a monastery, spending the whole lives meditating. But again, starting out, even 20 minutes can be a lot. So whatever you can do per day, when I'm really busy, even just 5 minutes is enough. And you don't have to do it all in one session. You can do a few minutes when you wake up, maybe like a few minutes at lunch before you eat, and then maybe later on at night. So whatever you can make happen is really important.
I have a question actually. Did they follow those patients past the 3 weeks? How far past did they follow them?
They did. So there was the second study, the ones for the patients who had uncontrolled glaucoma. They did 3 weeks first. They checked everything and they actually did another check 6 weeks later. And so it was overall about 9 weeks total. And they showed that the people who did meditation continued their effects. And really interestingly, so after the 3 weeks, they did the guided meditation 1 hour, and then the study designer said, okay, now for the next 6 weeks, all of you go home, do it by yourself, do whatever you want, and we'll check later and see what happens. So it was kind of a real world test to see, would people stay on top of it? Would they not? How would the pressure change? And for the people who were on the meditation group, the pressure stayed pretty much exactly the same. We don't know if they continue doing it or not. We would assume they did it to some sense, but maybe not an hour every day. But whatever it was, it still worked. Unfortunately, we don't have longer follow-up data than that. So that would be something that would be really important to see in the future.
Dr. Roscoe had a comment in the chat. Meditation overall has a positive benefit, cardiovascular disease and other stress-induced diseases. So your health as a whole.
Just one of the studies that I glossed over, they actually also took blood pressure along with it too. And they showed that both blood pressure and eye pressure all both decreased. And so I didn't touch into this study or many of the other just general studies for meditation, but they showed that it just helps with many other diseases in general.
So just one anecdotal experience, and Tony, I always find this so fascinating, and right, we always have patients asking, what else can I do? And to understand and treat or prevent further damage. And I had one patient in particular who I still recall came in and his pressure was really out of whack and his drops didn't appear to be working anymore. And, I'm asking him all these questions about, did you change anything? Are you doing anything differently? Yada, yada, yada. And it wasn't until he stood up at the end of the exam and got up to walk out of my office where he could barely walk because he was in so much pain because of his back. And I said to him, what's going on with your back? And he proceeded to say that he had thrown out his back and it was in so much pain. And I said, what is your blood pressure doing? And he said, oh, my blood pressure has been through the roof. And once we got the pain under control, the stress down, his blood pressure came down, as did his eye pressure. So it is, like you said, it's just all interrelated, and stress plays such a big role in so many other diseases. And I think this is so fascinating, this whole work that you're doing. So thank you.
Absolutely.
Incredible. Are there any studies in progress or any planned?
So I can't speak for other institutions yet. I know that this is still just like a very new thing. So I was applying for glaucoma fellowships and I was doing interviews at many other places and they were asking me, oh, just what's your research interest? And I brought this up. And it sounds like at the moment there aren't many other big institutions that are looking into this. they're all very interested and they're all very open to this idea, but I don't think many people are actively jumping into it right now. Dr. Roscoe and I were chatting about using the eye care home in the study. So that's a future idea in how we can have patients using the eye care home, finding out how their pressures are affected by this. So nothing completely planned yet, but we do have some ideas.
A lot of our patients at MyEyes, I do different practices, and they do track their IOPs based on the different things that they do, the different activities. So this is right in the wheelhouse. Another comment, absolutely happy to participate in any studies using the eye care home. I have Posner Schlossman, so not quite the same, but still dealing with pressure.
And I'll just chime in. So Posner Schlossman is not that common, but it is actually inflammation based, right? So we don't even really know what causes it, but it is a pro-inflammatory type condition.
Any studies on normal tension glaucoma and meditation?
So this one I think is really interesting. There's no studies yet on normal tension. The people that were involved in the study were mostly more of what we call just the primary open angle glaucoma who have high pressure in the beginning, but we're seeing in general that normal tension and primary open angle glaucoma, the what we call the regular kind of glaucoma, is just part of a spectrum. And that for people with normal tension, there's just some other factors that are more important than the pressure. And what I find really interesting and exciting is that meditation is targeting not just the pressure, but many of the other factors that we saw that are involved with just making the flow harder in the eye. So the stress response, the steroid inside the body, and then it can also help with the genes that are expressing that are helping with anti-inflammation. So there's so many other things that meditation is targeting outside of just pressure. So if anything, I think it would be really helpful for people with normal tension glaucoma, since pressure for them might not be as big of a factor compared to some of these other things.
Another comment. I've noticed a dramatic blood pressure drop when reducing refined carbs, like within a few days. I wonder if that would also help eye pressure. Do you know of any studies relating to refined carbs?
I have actually don't know at all. Dr. Roscoe, have you come across anything?
No, no, but I'm wondering again if it's just that sort of right, carbs and sugars in different patients can activate inflammation. I know you're supposed to limit, like if you have arthritis or knee joint issues, you're supposed to limit refined sugars and starches and carbohydrates. So it's possible. I'm wondering if it is again just an inflammatory process.
I wonder too. I know the fructose is really inflammatory, so
Mhm.
if your whole body's under inflammation, I wouldn't be surprised if your eye is also doing the same. And just something quick there is that I just thought on the top of my head. So with some of the carb-related inflammation, I know there's damage to some of the blood vessels, the inner lining of the blood vessels. And that same damage that happens there, that does damage the trabecular meshwork, the drainage system. Some of the genes expressed, and correct me if I'm wrong, Dr. Roscoe, but things like endothelial growth factor, those things are expressed more highly. And that is actually one of the things that was decreased by meditation. So, yeah, you might be onto something there.
I mean, we always think about the outflow system in the eyes, being different, but it really is, it's still a vascular channel. It's still endothelial cells. They just carry, aqueous fluid rather than blood. So, but they all have the same responses to the same mediators as blood vessels do.
I see another question here.
Yeah. How
That's
can
a
I
great
check
one.
blood flow to the optic nerve? Does that show up on an OCT?
Actually, yeah, absolutely correct. It's a specific OCT called OCTA for OCT angiography. Not every place has it, and just a regular old OCT machine does not necessarily have that. Some of the newer ones, it's combined. So OCT machine will have the OCTA along with it. And that's how they looked. They did OCTA and compared it before and after.
And there, one of the challenges is we it's such new innovative data. So there have been OCTA changes that have been correlated with neurofibril layer changes in glaucoma. But I mean, I think at this point, and Tony, chime in, we don't yet know what to do with the information. So when I have patients who I've sent for OCTAs and I'm showing some decreased perfusion, all we still have is trying to lower IOP or improve perfusion by controlling blood pressure. So it's sort of cutting edge research. There's a lot of people that are trying to develop therapeutics that will improve blood flow. I mean, one of the things I do tell patients is that if they have very low blood pressure, to actually, take salt, and eat potato chips and, Gatorade or V8 before they go to bed, because again, it does relate to blood flow. It's not just pressure. It's all related.
We have one more comment. Thank you for your insights. I learned quite a bit tonight, and just want to thank Dr. Roscoe and Dr. May for joining us and for your presentation. And we will have it recorded and posted if you want to go back and take a look or review anything. But I want to say thank you very much and have a great night.
Thank you so much, Tony. Thank you.
Absolutely. And everyone, please
Good night, everybody.
don't hesitate to reach out through email if you're curious for more things. Good night, everyone. Take care.
Thank you. Good night.
Thanks, Erica. Good night, everyone.